Are you a candidate for a mini facelift? This is Dr. Roy Kim, your favorite Dr. Kim, and I think, as always, it depends. So interestingly, mini facelift doesn't mean anything in terms of the world of plastic surgery. I personally believe it's a marketing term. It doesn't really mean a very specific, this is the anatomic area where we're making an incision and we're not. This is what we can do with limited incision or not. It just depends. So with a mini facelift, I think the thinking is that you don't need as much of an incision or you don't need quite as much surgery. Rather, you need a more limited incision or you need a little less surgery to get the same aesthetic results that you want. For me, if you want a lesser incision, like an incision just behind your ear or maybe a little in front of the earlobe and mainly behind your ear, and avoid an incision that's in front of the ear or in the hairline completely, what you need to do is be a little younger, have less loose skin to actually remove. We can do things endoscopically or sort of underneath the actual skin in hidden incisions. And yes, there may be a compromise as exactly how much I can do. The average patient is a little older, typically in their 50s or 60s, and they also may have a lot of sun damage as well as loose skin. So those patients typically need an incision in the hairline or in the ear or in front of the ear, because that's really the only way that I can access the exact facial areas where I can tighten the structures underneath the skin and I can remove a little skin and hide that incision. If you only have mainly loose neck skin or mainly loose neck and lower third of the face skin, mild jowling, maybe you could get away with fat grafting and not necessarily reposition of the cheek structures to get the best result, then yes, you're a candidate for a more limited incision, what I like to call a mini facelift. It just depends on you. If you are younger, and typically this is like in your 30s or 40s, then yeah, you're a much better candidate for this. There are some caveats or there are some things to be concerned about. One is that you may need a secondary procedure eventually in about 10, 15, 20 years. This is true for regular facelift, of course, but I do think that most patients, since they're older, they typically don't necessarily want to get another procedure 10, 15, 20 years after the original facelift. If you have more of a mini facelift, as I always like to say, I can slow down or reverse the hands of time, but I can't stop them. So as you continue to age, you will probably have continued loose skin, continued gravity working to pull down things towards your feet. In other words, loose skin around the jowl, and the structures underneath the skin will continue to go down as well. So yeah, you'll probably need an eventual revision or a secondary procedure sometime down the road. The other thing is that I think that patients aren't really fully understanding that plastic surgeons have become better and better at hiding incisions. So even though you know and I know that I'm making an incision in the earlobe, just in front of the earlobe or even in front of the ear, it's just very hard to see. We also try to hide the incisions in natural curves of the body. So this is also another reason as to why they're very difficult to see. So even though you and I may both know you had an incision in front of the ear, even with extreme magnification or scrutiny, those incisions are very hard to see long-term once they've healed up. So I think the days of having a more visible incision and wanting fewer incisions, I can understand the concern, but I also think that there's less of a concern because of better techniques and better anti-scar technology. So, do you have any other questions about mini facelift? Please let me know, fire away in the comments below, and as always, thanks so much for watching.